Yes,
think
we
he's working
are
on it.
gonna do All right.
Here we
It's all
go.
right. It's fine.
Good afternoon, everybody. It's been a little bit of a bumpy road today, but now I'm frozen. All right. So we're just going to get right to questions, I think, and I'll read through the data in a little bit, but let's get some questions answered first.
Okay, you guys
So
ready?
I'll go right off. Yep, I'll go right off my talking points if you want, Jen.
Okay, go ahead, Justin. Funeral assistance.
COVID-19 funeral assistance. There is assistance. It's called individual assistance for those folks who may have lost a loved one. If you need that information, you can find it at FEMA.gov/funeral-assistant/FAQ. There's information there. You can also call 1-844-684-6333.
And we also, Justin, have that link on our health department website on our normal COVID page. Okay,
Yeah, and
doctor.
sadly,
Go
some
ahead.
people might need that right now because we are
Yeah.
seeing an uptick in our deaths at this point. So,
and if anybody does have any questions on that, email COVID-19@stcounty.org and we'll help you with that as well.
Right.
Thank you.
Okay, so my talking point today is the J&J pause. The FDA, as many of you have heard, has recommended, not mandated, by the way, but has recommended a pause on the distribution of J&J. So obviously we have complied. We did have some plans to use J&J this week. We've just substituted all of our clinics are proceeding. We're just substituting the mRNA vaccine for the J&J, either Pfizer or Moderna. So we are following that recommendation. Just to note that out of 6.8 million doses, this pause was because of 6 cases of a rare and unusual form of a blood clot. This blood clotting was similar, actually, I might say, to the AstraZeneca, which is also a vaccine product that's made with adenovirus vector. So this is something unique to this type of vaccine, although I'll reiterate that it's extremely rare. In St. Clair County, we've administered a little over 3,000 doses out of all of our 31,000 doses. So for the most part, we have been using primarily Moderna and Pfizer. So this is, I want to remind everybody, and you can ask more questions about this, but everyone says, oh, this is a disaster. It's not a disaster. This is proof that our surveillance system works. And we've talked about this many times, that the trials and the phase 3 trials did not reveal any problem, but very rare events are picked up very quickly because we have a very robust system vaccine surveillance. So we were able to identify this quickly, pull the product so it can be studied more effectively, and we'll wait for the scientists to weigh in on what we should be doing next. So.
All right, thank you. Mm-hmm. All right, so are you going to go over any data or no?
Yeah, I'll let me pull it up real quick. I'm looking at our talking points, so give me 10 seconds and I'll have it up here.
I think the most important is to show the graph that the cumulative graph that we have, so you can kind of see where we're at. Our hope is that we're going to be seeing the end of the climb pretty soon, or if not already, and we can be anticipating some reductions in cases in the near future. It's good news.
All right, so I have the data in front of me. Total cases, 15,635 total cases. Total hospitalized, 633. We've lost 318 people, and currently we have 9,043 people recovered. Changes in the last 7 days, 1,510 new cases, 216 average cases per day, and that we're doing better on testing, 753 tests average per day on a 7-day rolling average. And we have dropped a little bit to 28%, down from 31.3%. So that is good news. The next slide, if we would have been able to put it up, and I apologize that we can't, would show that we did reach a peak and we have come down just a little bit, but we're still very, very high. There it is. Doc's holding it up. Lower it just a little. There you go. So you'll see there's a peak there, and then there's a lowering, which is really, really good news. So, and then I already talked about the testing. We're holding at 28%. Some new data that we have available, and then we have our vaccine uptake. And I'm just looking at it here. It looks like just over 10,000. There you go, Doc. Thank you.
I can't figure out which way to go because it's opposite.
You're good. You're good. You're good.
There we go.
And then, yep. And then there's a new slide that we added today that we wanted to talk a little bit about.
Oh, there we go.
Oh, thank you. So this is a new slide we're going to add, and it breaks down the cases by age in the last 30 days. So you can see there the 0 to 30, there's about 2,200 and some change cases there, which is it's almost a third of our 30-day count of cases. So it is extremely high in the younger generation than it was earlier on in the previous two waves. And so that's important to know. Some other interesting data, you can see the 61 to 80 or 90 plus is much lower than it has been in previous stints as well. And then as always, you can find our dashboard link at stclaircounty.org/offices/health/COVID19.aspx.
Thank you, Justin. All right, let's get on with the questions. I just wanted to let everybody know who's watching today. We have to end at 4:30. So if you didn't get your questions answered today, please email them to covid19@stclaircounty.org and we will work hard to answer those. Okay, first question,
And Jen,
Dr. Mercantante.
also,
Yes.
I apologize that I have to get off at 4 o'clock. So if anybody has any questions for me, make sure and send them to me and I'll get you an answer as well.
All righty. We'll have you do the first question then, Justin, because I know you have to roll out soon. Why did the health department schedule my son's second Pfizer shot at 30 days, but my daughter's second Pfizer shot at 21 days?
So the CDC says that we can go up to 6 weeks past the due date and everything is still fine. There's no issues with any sort of uptake. We did have some vaccine availability issues that we were working through to ensure that we could hit that 21 or 29 days, or I'm sorry, 21 or 28 days. And that's the reason for the first couple of main clinics that we've had to push that out to 28 days, just to ensure we had enough vaccine to take care of everybody. But you're correct, it is 21 days is when you're allowed to do the second dose, but there's nothing being hurt by doing it on the 28th day.
All right, Justin, I'll have you do one more question before you have to go.
Sure.
A friend of mine has gotten both her vaccines at Walgreens South. Both times she was never asked to wait the 15 minutes. Her mother called the health department to report it, and they said they couldn't do anything about it. I thought that was required. What would you tell me about that policy regarding this issue?
Yeah, so the 15 minutes is recommended. It can either be 15 or 30, depending on your personal medical situation. But it is recommended. There's not a requirement, right? But we follow that 15 or 30-minute recommendation at all of our clinics, and we would just hope that all of our partners do as well. But what they do, we can't necessarily control.
All right, and another question for you. What are the age groups that are testing positive in St. Clair County? I understand it's been a lot younger people. Do you have statistics on this?
Yeah, we kind of just showed it, and that was for the previous 30 days. And Russ, I don't know if you can put that back up, but I'll talk about it while we're. So I showed you that we have like 2,200 cases from that 10 to 30-year-olds. And you can see we're averaging right from like 11 to 20 all the way to 53 to 60 is kind of all averaging about 1,000 cases, give or take 20 or so. So that's where our main impacts are in the county right now.
All right, Justin, and your last question from last night is, in anticipation of the 12 to 16-year-old group being able to get vaccinated, can they sign up now to be in line when that happens? I'm asking for someone that will be 12 years old in May.
Sure. So what I'm going to say is we're going to put out an announcement when we want you to pre-register for that. Please don't pre-register yet. Because we're trying to minimize any sort of mistakes. You know, everybody's human. And if you pull that data gets pulled and, you know, inadvertently a 15-year-old gets the vaccine, we want to make sure we do it right. So we will give you plenty of time to pre-register, but please don't pre-register yet.
Okay, thanks, Justin. Okay, Dr. Mercantante,
Thank
St.
you all.
Clair, Sanilac, and Huron counties have the highest per capita infection rates and the lowest COVID-19 immunization rates in the state and in the nation. What is the plan to decrease the first and increase the second?
Well, the rates are going to decrease as I believe as vaccines go up and as compliance improves. The more people do the right thing, the quicker we'll see the rates go down. There is some variables with this virus that we don't fully understand either. I could say there's some components of why this has gone up and when it comes down that I think science has still yet to figure out. So kind of a hard question, and I'll just say that the best way to get the rates to come down is for everybody to stop going to parties and hanging out with each other and to get your vaccine. So how do we plan on increasing vaccine? We are working from every angle we can think of. So working with multiple community groups, looking at best practices, working our staff to the bone overtime, whatever it takes to improve access and uptake. We are at a point now where I think a lot of people who have been patiently waiting or impatiently waiting for vaccine have had access to vaccine, and now we need to reach those people who are vaccine hesitant, which is a pretty sizable portion of our community. I need to tell you, there's a ton of misinformation out there. There's a ton of I'll call it anti-vax stuff happening, and it's scaring a lot of people. So we do have our work to do, and we'll just keep doing it.
All right, thank you. The next question that came in last night was, what type of tests are done to detect antibodies? And could you talk about antibody treatment people are supposed to get from their doctors if they get COVID?
It's kind of two different questions, okay? So when we get infected with any kind of an organism, our immune system produces a variety of immune responses, one of which is antibodies. Antibodies can be detected through blood tests, and these are done through a variety of chemical tests, laboratory tests that need to be, your blood needs to be drawn and sent to the lab. The antibody treatment that you're referring to is called monoclonal antibodies, and these are we have a couple of them now, and they are available through a doctor's order. You can also call Tri-Hospital EMS. They have a system in place for home infusions. You have to meet criteria. It's not for everybody. So, talk to your healthcare provider about what those criteria are, or give us a call or give Tri-Hospital a call, because they'll tell you. And then that treatment can be provided in the first 10 days of a COVID infection, and it reduces your risk or chances of getting hospitalized for severe infection or severe disease. So two different things. I'll just say one more thing about checking your body for antibodies after infection. It may help determine whether or not you've had a COVID infection in the past, but that's about all it's going to tell you. A positive antibody does not tell you if you're protected, and I'm not going to get into the weeds for this, but basically the science just isn't there, and there's too much variability in the test. So a positive antibody test will not tell you when you were infected, nor will it tell you if you are protected from that infection. So you can't use it in a diagnosis method that way. Also, if you have no antibodies, that also does not mean that you do not have immunity. So if you've had your vaccine series and you go get your antibody test and it's negative, that does not mean that you're a non-converter or that the vaccine hasn't worked for you. It just means something else that we're not going to get into. And you don't get another dose of vaccine at this point as a result. So I'm going to encourage people to not worry about getting their antibodies tested because there's a lot of confusion out there, and it really doesn't help you much as far as what you got to do next.
All right. Thank you. The next question is, if I have COVID-19 and have not had any vaccine yet, how soon after can I get a vaccine? Doctors are telling me different time frames.
So if you've just been sick with COVID and you recovered, all we ask is that you've recovered and you are out of your 10-day period, your 10-day isolation period. Remember, you need to isolate for 10 days when you're COVID positive so that you don't spread the virus to other people. That's 10 days. It's also nice if you're feeling better. So I would say if you're still feeling really crummy, just wait a little while until you can walk around fairly comfortably. If you receive monoclonal antibodies, what I had just talked about, then you have to wait 90 days. Because those antibodies, so transfusion, it's in your body, and that treatment will fight your immune system from from creating its own antibodies. So we're going to ask those individuals to wait 90 days, but that's only if you've received a very specific treatment called monoclonal antibody infusion. You will know if you receive this.
Hey, Doc, someone asked if we have a decent supply of the monoclonal supplies on the way.
I think it's adequate. I think the state has worked really hard in bumping up that opportunity. For a while, we were sitting on a whole bunch of it and we weren't using it. But I think the hospitals are becoming a little bit more proactive in getting those doses started. I mentioned the tri-hospital EMS support system we have now in place. So I don't know if we have an unlimited supply, but I have not heard of any dramatic shortages at this time.
Someone else wants to know, is there ever going to be a drive-up COVID testing site anywhere in the area, being that we're one of the high-risk counties, it's extremely hard to get tested? Someone wants to know that.
Yeah, coming soon, hopefully next week. We'll announce it as soon as it's available. So we've been working on that now pretty steadily. Exciting thing about that is it's going to be a saliva test. So even less concerning to people than the swabbing your nose. So we'll announce that as soon as it's available as far as when, where, and the hours of operation.
Okay. Any updates on in-home vaccinations for the homebound?
Yeah, I think we've got it set. I think we have a support team now. They'll be able to go into the home. Our Visiting Nurse Association has taken up that role. People who are homebound will be, that information will be given to them, and they will be calling and screening those individuals to make sure they are in fact homebound and can get the vaccine, and then they'll figure that out. So again, if you have a homebound individual, send that name and contact information through our COVID-19 at stclaircounty.org, and we'll make sure it gets to the right organization so you get on their list.
All right, the last question from last night is, I've been reading that blood types make a difference with this virus. Is that true? Is O with RH a good blood to have to help with resistance of the virus?
There's not enough science to really answer that question. I think the latest meta-analysis or review of the data suggested it was not any considered a significant component. I think you guys pulled that data up. There was one study that suggested it, and then some other ones. But you know, when you think about it, you have no control over your blood type, anyways. I would not suggest if you had one kind of blood type that you do anything differently as opposed to somebody with a different kind of blood test. I wouldn't recommend that you not get vaccinated or you not wear your mask or any of those other things. So more to come on that, but I think the preponderance of evidence would suggest it's probably not going to be a significant factor in the disease process.
All right, so now we're going to move to the questions that are on the live feed. When do you expect to have vaccine clinics in Emmett, Capac, Yale area? Actual plans, please.
Okay, so I don't have the dates, but I know we're planning one in the Yale High School. I don't have the date. Next week or the week after. There's going to be a clinic. So you want exact dates, please, actual plans, please. So what you're going to have to do is look on our website and follow our social media feeds. So as soon as these get set up, vaccine clinics are getting set up quickly, but they have to be done pretty much as soon as we get the vaccine available. We're still getting about 2,000 doses of vaccine a week. So it's not like we have unlimited supply. So we set these clinics up once an agency is willing to provide us the space and the personnel, and we get those set up and going. So we have a request out to the state to provide us some extra vaccinators. There's a shortage of vaccinators. We can't do multiple clinics because we don't have enough vaccinators to spread out that thinly. So part of that will be done. But I would say, to summarize, I think we would expect at least one clinic in the Western area by the end of the month.
Thank you.
Stay tuned.
Marilyn asked, why is it we are highest with COVID in the U.S.?
You know, that's a great question, Marilyn. I think there's a few factors that we can consider reasonable, and then there's probably some factors that we really don't understand. Number one, there's a variant load in this county throughout the state. I think it started here. The variant is more infectious, it spreads more easily, and it happened to land in a community where we have a lot of people who don't pay attention to our risk reducing strategies. They don't wear masks, they don't stay separate, they don't follow isolation and quarantine rules, they don't test, they don't even answer the phone when we try and help figure out where they've been. So you put a highly infectious or a more infectious virus in the midst of this, and we watched that happen over the course of 2-3 weeks. We just watched it explode, and it was kind of a really sad thing to see. But I would say a combination of bad luck with the variant landing here, and an environment where there was a lot of noncompliance. And I have to say, too, there's some theories that maybe because we didn't get hit real hard the last time, that maybe we had even more vulnerable people in our community than maybe other places that have already had their hot spots. In other words, we had more immune naive people that were exposed. So I'm sure there's some other factors here that we don't quite understand yet. And as soon as we hear something more, we'll make sure that we share it with you all.
All right, the next question is from Terry. They ask, what age groups are the positive test?
I think we showed that already. Yep, there it is. This is a shift. I can tell you a month ago, we had a very high peak in the 10 to 18-year-olds. That's how we knew where it was coming from. Everyone says, oh, it wasn't the kids. Well, it was in the kids. It was started there. We had a very high spike. That whole graph looked differently. But right now, as of this week, is this week's data? This is the last 30 days of how it's balanced out. So definitely a younger shift, and I'm just grateful, I guess, that those older people have hopefully had a higher level of vaccination, or they're just being more careful and they're not going out and not being exposed as much. I'm not sure. Exactly.
All right. Heather asks, can an already made appointment for second dose with the health department be changed? If so, how? I'll help answer this one if you don't mind. We really highly encourage people to keep their second dose appointment, just because those are accounted for. We understand that sometimes things important happen, but if that's the case, please email us at covid19@stcounty.org. If
I will say
there's
this,
no way to
we
keep
can
it.
accommodate you. Don't worry, you'll get your second dose. We can accommodate this. It's just a lot of logistic stuff that we have to change. So send us an email and we'll definitely get in touch with you about how to make that happen.
Kelly asks, do you feel it's smart to go back to face-to-face learning right now?
A lot of questions about that. As you know, a couple weeks ago, we strongly recommended schools take a pause, especially the schools that were having clear transmission in their classrooms. Remember, recommending what schools do is not so much based on the community transmission, although there's a very strong correlation between that and what's happening in the schools, but really more importantly, if the strategies that they're using within the schools for the face-to-face learning are working. So if you're not getting a lot of transmission of the virus within that learning environment, then everybody would like kids to stay in school, right? So that was happening. The pause was a good idea. It is obviously everyone where the pauses are, there have not been more cases identified within the schools. So we have, in fact, not made any recommendation one way or the other at this point. What I do think, with the rate still as high, is that if they do go back face-to-face and are not really careful, and if you parents are not really careful about not sending your kids to school when they're sick and not keeping them home when they're quarantined, that there will be another pause. And what we really talked about yesterday, I think it was yesterday or the day before. Was it yesterday? I talked to the schools. I lose track. Is that we are neither recommending for or against it, but do be aware with the rates being so high that there are risks that this will not work out really well as far as staying in school. I hope I'm wrong, and I think if people are really careful, it could be done.
All right. Jennifer asked, I tested positive today and my husband is negative. Should he get his scheduled second dose on Friday?
No, your husband would be in quarantine. Okay, I'm assuming that you live with your husband. I hope you do. So So if you have a positive test, your household is essentially then quarantined from the last date that they're exposed to you. So since you are now supposed to isolate for 10 days from the onset of your illness, unless you and your husband start, having separate living quarters, his quarantine starts 10 days from now. So we ask that people who are quarantined are not going into public spaces. Please don't come to our big clinics to get vaccinated. If we have a drive-through clinic, it might be a little safer then. But remember, getting a vaccine after your exposure is not going to prevent you from getting sick. And when you get sick right after a vaccine with COVID, it's probably because you were already exposed to COVID before you got your vaccine. So we'd recommend that he just wait until his quarantine time is over.
Okay. The next question from Alex. Is it possible to use McMoran for a vaccination site?
Yeah, we talked about that. That's a Diane thing. So the logistics of vaccines, large vaccine clinics are huge. There's the in and out, there's the parking, there's the waiting area, and I don't know exactly why the reason McMoran was decided not to. Do you remember why we didn't go there? Oh, that was it. Part of it is they had stuff going on. They didn't have space for us. So I forgot about that. Yeah. So yeah, we do consider all these places, and it's not to say we might not use it in the future. But we did find that between the Blue Water Convention Center and now at the Knights Club in Marysville, that those spaces just had, they were available to us. And I think they've worked out very well so far.
And you covered the question from Lynn, so I'm going to move down to Stephanie's. CDC is recommending our governor close things down like a year ago. What do you think about this?
I don't think it'll work because I don't think anyone will do it. I think lockdowns do work, okay, if everyone did it, but I think we've all experienced the pushback. I've already mentioned the lack of compliance even in our school age population. It won't work if half the population isn't doing it. And so I think that's where our governor's coming from. That's certainly where we're coming from. We are appealing to people's sense of responsibility and also maybe their sense of concern of liability, because our advice is based on the best evidence. We consider ourselves experts as much as we can be with this novel virus on the best things to do. And if you choose to ignore, I'm frozen.
You're frozen.
Okay. If you choose to ignore that and somebody catches COVID from you and dies, I think that liability is yours. And I think that's the thing that people have to keep in mind. I don't know where liability is going to go, quite honestly, but I think those of you who are concerned about this need to keep doing the right thing and protect. And I said this last week, protect yourselves. Get your vaccine. Don't go out if you're sick. Don't do, follow your quarantine and really follow our guidelines, because that's the best way of being protected. And I would say that lockdowns happen almost organically. As I mentioned, the schools, things shut down because so many people get sick that you no longer have a workforce that is functional. And that's what we see throughout the county, throughout the state, things shutting down because people can't show up for work. So something else to consider.
Amanda asked, she was told Port Huron Hospital is filled with people on vents, that they have had both vaccines. Just wondering if that is true or not.
It's not true. There are people who are getting infected that have had both vaccines. For the most part, they are not landing in the hospital and they're not dying. There probably will be a couple of cases, but they are the rarity. The vast majority of people who are getting hospitalized are not vaccinated. We don't have the exact data. Do we have any of that data yet? We have some of it.
We've had 3 out of 6,000.
3 out of 6,000 cases that have been fully vaccinated. So you're not out of the woods. I'm not going to say vaccination is the panacea. You don't worry about anything anymore. It's not the way it is, but it certainly goes a long way to preventing you from landing in that hospital and getting on that vent.
All right, the next question is from Sue. Why are there walk-in clinics when there's people waiting for notifications of available of vaccines?
If you are still waiting for a notification, there has been a disconnect with your registration, and redo it, okay? Because we have gone through that list now several times. So if you haven't gotten notified, there's a problem with the registration in our system. So please get back on the registration system, make sure the information's correct. Send us a COVID-19 email. We'll go back into the system ourselves and double check and look for you. But everybody in our system has been notified at least once, if not multiple times. Which is why we have the walk-in, because we go through the entire list, we schedule everybody that responds, and we still have room for more. And so that's why we're opening it up to walk-ins at these larger clinics.
This is kind of a conversation going on with the feed today, but somebody asked, how is not closing the schools logical if them being open is contributing to the spread?
I don't think there's a lot of data that suggests the school learning, in-person learning does not particularly contribute to the spread of the virus. The spread of this virus is community-based. It's what people are doing at home and outside the school environment. I'll say this again, the schools pause when they can't function anymore because there's too many people out that are sick, too much absenteeism, and they're having difficulty staffing their in-person classrooms. It becomes an operational issue. Pausing the schools does not slow down the transmission of the virus in any way. It just helps the schools function because of the sheer number of people. So stopping and starting the schools, pausing and unpausing virtual learning really isn't to control the spread of the virus. It's to provide support for the schools to do what they want to do, which is to educate the kids in person. I still believe that kids being in the schools is the best place for them to be, even in an environment like this where there's a lot of viral transmission. It's the best place for many reasons. Not to mention, is probably in many cases they have less risk of getting exposed in the schools because they're wearing their masks and their teachers are paying attention to where they're sitting and what they're doing, as opposed to when they leave the school building and they're doing other things. So it's a tricky question, but I wanted to be very clear that when we recommend pauses, it's generally to support the school's decisions that they already know they have to make because they're having a difficult time with operations, not because we're trying to control the spread of the virus in that environment.
Okay, next question is from Cindy. Who is in charge of the number of vaccines we are getting?
The state is in charge of that.
Okay. Who can, this is from Cindy as well, who can issue executive orders, local or state?
Both. Actually, executive orders is a misnomer. We can, as a local health department, issue epidemic orders, cease and desist orders, emergency closures. We can do all the same things the state does based on the public health code.
This is from Cindy. How do we reach people who don't have the internet?
The phone. They call us. We are having doing a great deal of outreach work through various community organizations, human resource organizations that have their own client lists that are reaching out individually to those people. So any way we can, quite honestly. We understand that the system we had initially when there was that large uptick of needing vaccines was limited because it was computer-based. But quite honestly, I don't know how else we could have managed the thousands and thousands and thousands of people who wanted vaccine. So we'll just keep working on that.
All right. Cindy also asks, how do we get more funding for St. Clair County?
I don't think it's not a funding issue. It's a people issue. It's a resource issue. How do you hire more people? We got plenty of money. You talk to the hospitals right now, it's not funding, it's finding bodies to do the work. And we're having the same issues even with our vaccination clinics. Finding bodies to do the work is really the issue. Because everybody's looking for them all over the state. It's not just us.
Linda asked, if I had COVID, can I get it again?
Yes, you can. We're not really sure how likely you are to get it again, or if you are more likely or less likely to have a severe infection. But there are many, many cases that now have been um, confirmed of a reinfection after a previous infection. I would say getting reinfected after a natural infection is more likely than getting infected after a vaccine, or at least that would be my impression. I think we'll have more information about what that is over time. But if you've been infected in the past, it's not a done deal. You still need to follow those precautions.
Doc, I'll let you know it's 4:25, so we have several more questions. So I
All
will
right.
try to get through, and we'll end as soon as we can. From Cindy, the guidance tells us that if you are fully vaccinated and exposed to COVID, you do not need to quarantine. As the variants are spreading, does the vaccine protect against the variant? If not, shouldn't we be quarantining after any exposure?
Not yet. So far, the vaccine appears to be very effective against the variants that are circulating right now here, which is primarily the B117 variant. And so with that effectiveness, the same recommendations hold with this variant. So if you're fully vaccinated, you don't have to quarantine. If you're fully vaccinated and get sick, we still want you to isolate and get yourself tested. But if that changes, we'll let you know.
Mackenzie asks, it appears cases are slowly coming down since the start of the week. It is also the week elementary schools went remote. Is it safe to assume young children are asymptomatic and aiding to community spread?
I think we know that young adults and children are much more likely to have asymptomatic infections. I think that's very well documented. Are they aiding to the community spread? It depends what they're doing. Okay, so actually, I think the data would suggest that very young children in elementary school are the least likely to spread because they're the most compliant with all the things we ask them to do. They do a lot less social networking at the end of the day, things like that. So I think every asymptomatic infection is contributing to the spread, which is why we like to test people. Can I just go there for a minute, Jen? I don't know. Is anybody asking any questions about testing? All right, there's a lot of pushback about I don't want my kid tested. Testing is invasive. It's bad. Testing is one of the few tools we have that's going to help. Okay, if you want your kids to go to school, let us test them. Because if we are going to find these asymptomatic infections, that is the only way we're going to find them is by testing. If we find them and separate them from the rest of the classroom, they're not going to have the chance to spread. So testing is our friend. Testing is a good thing, and testing is what we need to do if we want to have any semblance of normalcy and have our kids be doing anything at all. So I'd be happy to elaborate on more of that later, but it seems quite silly to me, quite honestly, that people will be opposed to testing because it's a tool we have to help people do things and continue to do something besides sit around in their home and play video games. So let's do some more testing. It's the way to go.
All right, this is from Kelly. Did the CDC up quarantine to 14 days recently?
The CDC has always recommended 14 days as being the ideal time, the safest duration of time to make sure that you don't inadvertently spread your infection after exposure. Okay, the state and the CDC had loosened those out and given us some shorter options, but with the increased contagiousness of the variant, both the CDC and the state have weighed in and say with variant activity, 14 days is a much better option. So for now, we are staying with 14 days.
All right, this is from Michelle. I have a scheduled second vaccination appointment. The first time I went, they asked for us to sit in a room 6 feet apart from other people. Is this a requirement? Can I wait the 15 minutes in my car away from everyone else?
Yeah, it's not a requirement. We talked about that before. These are recommendations for your safety because if you're going to have an immediate allergic reaction to a vaccine, it generally occurs in that first 15 minutes. So it's for your safety that we ask you to wait. And if you don't wait, it is at your own risk. Can you wait in your car? Sure, but who's going to know you're there? who's going to come and help you out if you have a problem in your car? So that's why we ask you to wait in an area that we have nurses and we have, you've seen us there. We have things there to help evaluate the situation and make sure that you don't need more intensive care, which is very rare, by the way. But we do have a lot of people who faint, a lot of people who feel dizzy. I mean, those are normal reactions after a vaccine, after any kind of a shot. And so we like to have you right in our eyes so we can make sure that you're okay.
All right, the question from Kathy is Michigan National Guard helping with any of your max vaccinations?
We have not needed them for any of our large vaccination clinics. We have requested them so we can spread out a little bit more. There was that question about getting out into the west side, getting into the schools, getting some of our 16 and 17-year-olds vaccinated, and we just don't have the manpower to spread out. So we have requested the Guard to do some of that, and I'm hoping we can get them in here in the next couple of weeks to help us out.
Kelsey asks, how can you push a vaccine that is making people sick, some die, cause blood clots, etc.?
Well, that's a loaded question, isn't it? So first of all, let's go with the mRNA vaccines, the Moderna and Pfizer vaccines. There have been no deaths that have been tied to the vaccine. In other words, there have been deaths after the vaccine, but when they look at the cause of death, it has got nothing to do with being vaccinated, okay? And we've had 180 million doses of these vaccines provided, so we have an abundance of information that makes us feel very good and pretty comfortable that these vaccines are not killing anybody. On the other hand, COVID's killing a whole lot of people. So let's put that in perspective. So let's go to the adenovirus vector vaccine, the J&J, and also the AstraZeneca, which we don't have in this country yet, but a similar formulation. Those vaccines are causing very, very rare events, clotting events that have killed some people, but we're talking about a minuscule amount of people. So again, we have to weigh, number one, we need to know more about who is at risk for those kinds of events, those rare events with these vaccines, and know who to give that vaccine to and who not to. But again, weigh that potential risk, a 0.0008% risk of something like that happening versus a 2% mortality rate if you get infected with COVID. It's quite honestly a no-brainer that vaccines, in my opinion, and the opinions of most experts and anybody who knows anything about vaccines can tell you that these vaccines are your best bet of not dying from COVID. And you're not likely going to die from this vaccine. I think the risk of you dying from a lightning strike is actually quite a bit higher than dying from any one of these vaccines, even the one that we just paused. Okay, so I think you need to go back and kind of look at that a little bit closer and kind of just think through it again, because it's really about relative risk here. It's really about what's really at risk to your health. It's not the vaccine, people. It's the virus. The virus is the problem, not the vaccine. Okay.
Thank you. Cindy asked, are you in charge of closings for St. Clair County?
I'm not in charge. I have not ordered any closures to date. That question came up. Is there a legal possibility? I can legally do it. The question is, why would I do it? Just because I can do something doesn't mean we should do it. Will it help? Will it make a difference? So far, we've only used our legal authority as a health department to enforce epidemic rules when we had businesses that were not supposed to be operating. Remember in that time where we weren't supposed to have certain businesses operating and they were anyways, we used our authority to enforce that. Not to close them, but to make sure they were following the epidemic orders. Actually, some of them were to make sure that they weren't operating. But those were temporary and those no longer exist. Remember, we don't have any closures at this time. We ask people to just do the right thing and function and operate their businesses with the understanding that the more people that come in and out, the greater your risk of being part of the spread of that virus.
Okay, and it looks like we just have a couple more questions. We're just a little bit over, but Mike asked, is the B117 the largest variant in St. Clair County?
Oh, by far. By far. I think our last count, we had 180 confirmed variants. I have no idea what that means proportionally to how many disease, because I can't tell you out of all of our samples how many of those the state is actually testing. But by far, they're all, I think, for the exception of one or two, maybe one has been B117.
All right, we have two more questions. This is from Sheila. I received the J&J vaccine the beginning of March. Should I still worry about the issues? I have MS and had strokes before, so I'm really worried.
So probably not. The 6 cases that they're studying, again, 6 cases compared to 6.8 million doses, they all occurred within 13 days. Okay, so I think you're kind of out of the woods that way. But I would say to anyone who's received a vaccine, or even if you haven't received a vaccine, if you're having stroke-like symptoms, very unusual severe headaches, visual or hearing distortions, balance issues, anything out of the ordinary, you should seek medical care. The hospitals are still open. They are still taking care of people, and they will take care of you if you show up with these concerning symptoms. So please don't sit around at home and worry. Now, if you just have you're worried and you feel fine and you happen to get the J&J vaccine 3 or 4 days ago, you don't need to go to the hospital to get this set up. These events, as I mentioned earlier, are stroke-like events. They're very profound. These are not subtle findings. These are thunderclap headaches that you've never experienced before. Really, things that there's something wrong. So, and again, if you're not sure, you can call your doctor and talk to them, or even give us a call. We'll try and guide you a little bit. So that's my word of advice and actually encouragement. I really think the risk of this vaccine is so small that we're going to be really looking at more at who shouldn't get the vaccine and proceeding with the ideas that the benefit still far outweighs the risk. But we'll see how the ACIP and the CDC weighs in on it. So far, they had a special emergency meeting yesterday, and they chose not to vote. They're going to study it a bit longer and have another emergency meeting next week. And we will follow the experts' advice on this.
All right. We had a couple questions on this, and we can end here. And I apologize if we don't get to the rest of the questions, but people can email us those that we missed. Pfizer is telling us we need a booster in the next 12 months. What's your knowledge on that as far as that goes? And also, is that going to happen with Moderna as well?
I'm not prepared to talk about that. I think this was a little preliminary, like maybe this, maybe that. I need to look at the information a little bit more closely before I would predict anything quite like that. I do know that the protection that both of these vaccines give are likely at least beyond 6 months. We know that they're absolutely good for 6 months, and we expect them to be much longer than that. And seeing what this wave is doing to our hospital systems, this is our 3rd wave. I would say it's in your best interest to have that 1 year's protection is well worth the benefit.
All right. Anyone who we missed today, please email us your questions at covid19@stclaircounty.org, and we will be back next week. Doc, any closing comments?
Well, sorry we're late. Sorry about the technical difficulties. I'm hoping next week we'll be able to give you some good news that these rates are coming down. Remember that what happens with these cases has a lot to do with you and what you do and what you don't do. So hang in there, do the right thing, and we'll get through this together.
Thanks, Doc.